Lower back pain is a common concern for adults over 60, often resulting from weak core muscles, tight hip flexors, reduced flexibility, and poor posture. Today we're covering 5 gentle exercises specifically designed to address lower back discomfort: pelvic tilts, glute bridges, single knee to chest stretch, piriformis stretch, and hamstring stretch. These movements target muscles supporting spinal health, hip flexibility, and proper alignment. When practiced consistently with proper form, they can help reduce lower back discomfort and improve mobility. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting exercises for back pain, especially if you have herniated discs, severe arthritis, recent surgery, or acute injury. Understanding lower back pain after 60. Lower back pain affects majority of adults over 60 at some point. Common causes include weak core and gluteal muscles failing to support spine, tight hip flexors from prolonged sitting, reduced spinal flexibility with aging, poor posture habits, and degenerative changes in spinal structures. While some discomfort is common, persistent or severe pain requires medical evaluation. These exercises address muscular causes of lower back discomfort through gentle strengthening, flexibility work, and movement re-education. They are most appropriate for nonspecific lower back discomfort, not acute injury or diagnosed spinal conditions requiring medical treatment. Exercise 1, Pelvic Tilts for Core Awareness. The first exercise is pelvic tilts, building core awareness and gentle spinal movement. This subtle movement teaches proper pelvic positioning while gently engaging deep core stabilizers. Here's how to perform pelvic tilts safely. Lie on back on mat or firm bed. Bend knees with feet flat on floor, hip width apart. Rest arms by sides, palms down. Place hands lightly on pelvis to feel movement. Inhale slowly through nose. As you exhale, gently tilt pelvis backward, pressing lower back toward floor. Think about flattening lower back curve. Feel gentle abdominal engagement. Hold for 2 to 3 seconds. Inhale and return pelvis to neutral starting position. Don't lift hips off floor, this is subtle pelvic movement only. That completes 1 repetition. Perform 10 to 12 repetitions. Move slowly with breath. Complete 1 to 2 sets. Important reminders: movement is small and controlled. Focus on flattening lower back against floor during tilt. Breathe naturally throughout. Keep shoulders and upper back relaxed. Avoid lifting hips, this is pelvic movement only. Modifications: if lying flat is uncomfortable, place small pillow under knees. For limited mobility, reduce range, making movement even smaller. What to realistically expect: with regular practice daily or several times weekly over 4 to 6 weeks, you may notice improved awareness of pelvic positioning, gentle core strengthening, reduced morning stiffness for some, and better understanding of neutral spine position. Pelvic tilts build foundation for proper core engagement. Exercise 2, Glute Bridges for Posterior Chain Strength. The second exercise is glute bridges, which we've covered previously but remains essential for lower back health. Glute bridges strengthen gluteus maximus, hamstrings, and lower back stabilizers while teaching proper hip extension pattern. Strong glutes reduce lower back compensation during daily activities. Proper form: lie on back with knees bent, feet flat, hip width apart. Press through heels, lift hips creating straight line from knees through hips to shoulders. Squeeze glutes at top, hold 2 to 3 seconds. Lower with control. Start with 8 to 10 repetitions, 1 to 2 sets. Avoid overarching lower back at top. This foundational exercise builds posterior chain strength, essential for spinal support and proper movement patterns, reducing lower back stress. Exercise 3, Single knee to chest stretch for lower back release. The third exercise is single knee to chest stretch, gently decompressing lower spine and stretching hip flexors. This gentle stretch reduces lower back tension and improves hip mobility. Here's how to perform single knee to chest stretch safely. Lie on back with both legs extended or both knees bent, whichever is more comfortable. Slowly bend right knee toward chest. Clasp hands behind right thigh or on top of shin, not pulling on knee joint. As you exhale, gently draw knee closer toward chest. Don't force, let gravity and breath assist. Hold for 15 to 20 seconds, breathing slowly and deeply. Feel lower back lengthening and relaxing. Gently release and return leg to starting position. Repeat with left leg. Complete 2 to 3 rounds on each side. Critical technique points: move slowly and gently throughout. Never force knee closer, allow natural comfortable stretch. Breathe deeply during hold. Keep opposite leg either extended or bent with foot flat for stability. Relax upper body and shoulders. Modifications: if lying with legs extended causes discomfort, keep opposite knee bent with foot flat. For tight hips, hold stretch at comfortable range even if knee doesn't come close to chest. For progression, after single leg, try bringing both knees toward chest simultaneously for deeper lower back stretch. What to realistically expect: with regular practice several times weekly over 4 to 6 weeks, you may notice reduced lower back tension, improved hip flexor flexibility, decreased stiffness after prolonged sitting, and enhanced spinal mobility. Gentle stretching decompresses lower spine, reducing discomfort. Exercise 4. Piriformis Stretch for sciatic relief. The fourth exercise is Piriformis Stretch, targeting deep hip rotator muscle that can compress sciatic nerve. Tight piriformis muscle contributes to sciatic type pain and hip stiffness. Here's how to perform Piriformis Stretch safely. Lie on back with knees bent, feet flat on floor. Lift right foot and place outer edge of right ankle just above left knee, creating figure 4 position. If this position alone provides stretch in right hip, stay here and breathe. Otherwise, gently lift left foot off floor, bringing left thigh toward chest. Thread right arm through space between legs. Clasp both hands behind left thigh. Gently draw left leg closer toward chest until you feel stretch in right hip and outer glute area. Hold for 20 to 30 seconds, breathing deeply. Slowly release and switch sides. Repeat 2 to 3 times per side. Important form reminders: move into stretch slowly and gently. Never force deeper stretch, allow natural comfortable range. Breathe deeply throughout hold. Keep upper body and shoulders relaxed. If figure 4 position is uncomfortable, skip threading arm through and simply hold bent knee. Modifications: for limited hip mobility, perform seated in sturdy chair with one ankle resting on opposite thigh, gently lean forward. For tight hips, hold stretch at comfortable range, even light stretch provides benefits. What to realistically expect: with regular practice several times weekly over 4 to 8 weeks, you may notice reduced hip tightness and stiffness, decreased sciatic type discomfort for some, improved hip rotation flexibility, and enhanced comfort during sitting and walking. Piriformis Stretch addresses common source of hip and lower back discomfort. Exercise 5. Hamstring Stretch for posterior chain flexibility. The fifth exercise is Hamstring Stretch, improving flexibility in posterior chain muscles. Tight hamstrings contribute to lower back pain by limiting pelvic movement and increasing lumbar stress. Here's how to perform hamstring stretch safely. Lie on back with both legs extended. Bend right knee toward chest. Place hands behind right thigh, clasping or resting there. Slowly extend right leg upward toward ceiling. Leg doesn't need to be completely straight, extend to comfortable range. Flex foot by pulling toes toward face for enhanced stretch. Hold for 15 to 20 seconds, breathing slowly and evenly. Gently bend knee and return leg to floor. Repeat with left leg. Complete 2 to 3 rounds per side. Critical technique points: move slowly into stretch without bouncing. Never force leg straighter, work within comfortable range. Keep lower back on floor throughout, don't let it arch up. Flex foot to enhance stretch along entire posterior chain. Breathe deeply during hold. Modifications: if lying is difficult, perform seated in chair with one leg extended forward, heel on floor, gently hinge forward from hips. Use towel or strap looped around foot if you cannot reach thigh comfortably. For very tight hamstrings, keep knee more bent while extending upward. What to realistically expect: with regular practice several times weekly over 6 to 10 weeks, you may notice improved hamstring flexibility, reduced lower back pulling sensation, better forward bending ability, and enhanced overall posterior chain mobility. Hamstring flexibility is essential for proper pelvic alignment and reduced lower back stress. Creating gentle lower back routine. Here's how to integrate these exercises into effective routine. Practice all 5 exercises once daily, preferably morning or evening. Sample routine: pelvic tilts, 10 to 12 repetitions. Glute bridges, 8 to 10 repetitions. Single knee to chest, 2 to 3 rounds per side holding 15 to 20 seconds. Piriformis stretch, 2 to 3 rounds per side holding 20 to 30 seconds. Hamstring stretch, 2 to 3 rounds per side holding 15 to 20 seconds. Complete routine takes 10 to 15 minutes. Can be performed on mat, carpet, or firm bed. These exercises can be done together or split throughout day as convenient, such as some in morning and some in evening. Essential safety considerations for back exercises: these exercises address muscular causes of lower back discomfort but are not appropriate for all conditions. Stop any exercise causing sharp pain, radiating leg pain, numbness or tingling in legs, or significant increased discomfort. You should not perform these exercises without medical clearance if you have herniated or bulging discs, severe spinal stenosis, acute back injury within past few weeks, recent spinal surgery, or diagnosed spinal conditions. Always consult healthcare provider or physical therapist before beginning exercise program for back pain. These exercises work best combined with proper posture during daily activities. Regular gentle walking is tolerated, avoiding prolonged sitting or standing, maintaining healthy body weight, and stress management practices. Comprehensive approach addresses multiple factors contributing to lower back discomfort. Realistic expectations for improvement: lower back discomfort often improves gradually with consistent gentle exercise. Week 1 to 2, learning proper form and technique, initial awareness of muscles being worked, some may notice slight improvement in flexibility. Weeks 3 to 6, exercises feeling more natural, noticeable improvements in flexibility and movement, reduced stiffness for some, enhanced body awareness. Weeks 6 to 12, more significant improvements in lower back comfort for many, better flexibility and strength, improved daily function, established sustainable routine. However, not all lower back pain responds to exercise alone. If pain persists, worsens, or includes red flags like radiating leg pain, numbness, or weakness, consult healthcare provider for proper diagnosis and treatment plan. Importance of consistency and patience: lower back improvement requires consistent gentle practice over weeks to months. Quick fixes are rare for chronic discomfort. Daily or near-daily practice of these gentle exercises provides better results than sporadic intense sessions. Start conservatively with comfortable ranges and progress gradually. Listen to your body and modify or stop if exercises cause increased pain. Some days will feel better than others, which is normal. Missing occasional day is acceptable, simply resume when able. The goal is sustainable long-term practice supporting spinal health and reduced discomfort over time. Complementary practices: these exercises work best as part of comprehensive approach to back health including proper ergonomics during sitting and standing, regular gentle movement throughout day, avoiding prolonged positions, maintaining healthy body weight, reducing spinal stress, stress management as tension contributes to muscle tightness, adequate sleep supporting recovery and healing, and proper nutrition supporting tissue health. Address multiple factors contributing to lower back discomfort for best results. When TO seek professional help, consult healthcare provider promptly if you experience severe unrelenting pain not improving with rest, radiating leg pain with numbness or tingling, weakness in legs affecting walking, loss of bladder or bowel control, medical emergency, or pain following trauma or fall. Additionally, if gentle exercises don't provide improvement after 8 to 12 weeks of consistent practice, consult physical therapists specializing in lower back conditions for personalized assessment and treatment plan. Conclusion: these 5 exercises, pelvic tilts, glute bridges, single knee to chest stretch, Piriformis Stretch, and Hamstring Stretch, provide gentle comprehensive approach to addressing muscular causes of lower back discomfort. Start at comfortable ranges using all suggested modifications. Practice daily or several times weekly consistently. Progress gradually based on how your body responds. Stop if exercises cause increased pain. Listen to your body always. Combined with proper posture, regular movement, and healthy lifestyle practices, these gentle exercises can help reduce lower back discomfort, improve flexibility and strength, and enhance quality of life for many individuals. Thank you for watching. For persistent or severe lower back pain, consult with healthcare provider or physical therapist for proper diagnosis and personalized treatment plan. Subscribe for evidence-based information on gentle exercises and pain management for older adults, practical guidance prioritizing safety while helping you maintain comfort and mobility.